So there are some couple of things that you do when uh, there is a shoulder dislocation. Okay, when there is a shoulder dislocation, there are some couple of things that you do. Okay, so for the things you do for the nerves, you always test if there's a medial nerve injury or radial nerve injury or ulnar nerve injury or musculocutaneous nerve injury once there's a shoulder dislocation. All right. So let's quickly look at this aspect. Medial nerve, radial nerve, ulnar nerve. So it's very important to always test for these major nerves, okay? Because when there's fractures around that side, they could be affected, you know. So medial nerve, how do you test for it? You ask the patient to oppose the thumb to the little finger, do like this, okay? So you test sensation over the palmar surface of the index finger and the thumb. Then radial nerve, how do you do it? You ask the patient to extend the wrist and fingers against resistance. Okay, so you see a wrist drop if it is weak. So sensation, you check the sensation over the dorsal aspect of the hand, especially what the web space between the thumb and the index finger. Okay, so ulnar nerve now, motto, you ask the patient to abduct or adduct the fingers. They should bring it this way, not like this. Or open, just simply open it like this. So sensory, you just test if the little finger is still feeling some sensation. Then for the musculocutaneous nerve side, you ask the patient to flex the elbow against resistance. So sensory, you check sensation over the lateral aspect of the forearm. So clinical importance is axillary nerve is actually the most common injury in the anterior shoulder dislocation. So you always check for the deltoid. So also always document neurovascular status before and after reduction. So any deficit requires urgent orthopedic and possibly neurovascular um, evaluation. Okay, so that was what we got for this.